Thank you, thank you.
How often do you do Apgar? You do 1 in 5 minutes, but then if they have a poor score,
Every 5.
every 5 minutes for like the first,
For how
get a good score.
and until you either stop interventions because things have become futile, or they are better and they're going to be going to the NICU. Okay, so babies, why is it so hard for them to maintain their body temperature? Where do they lose most of their heat? Because if you look at a baby, even the sweetest, cutest little normal newborn baby, their heads are really, really large in comparison to their body, right? Lots of blood vessels. Because lots of blood vessels and they're really close to the surface. Most babies don't have a lot of subcutaneous fat. So I'm not talking about our GDN babies. What do babies instinctively do that helps them maintain their body heat? Flex. That is a term baby. Is the premature baby going to look like this? No. They're going to be like this. Right? They're flexed.
I know they say that shivering, that babies don't shiver.
Babies cannot shiver.
But I've seen babies in the nursery shiver.
That would be a jitter.
Jitter.
They might be jittery if they have low blood sugar, things like that.
So they were looking like they were shivering.
And not only that, and they are super, super, super overstimulated because they've come from this dark, closed, and quiet and muted environment to that, exactly.
Okay.
But it's not in response to cold.
Okay, I knew I read no shivering doesn't generate heat, but I swore that they do.
You didn't think I knew the difference between shivering and jittery?
I didn't know what shivering.
Okay. So tell me the difference between a caput and a septal hematoma. And it crosses the suture line. Yes. And the septal hematoma? Right, so it's like on one little side, they kind of look a little pointy. It's probably being stuck in the birth canal there for a while. And that's another really nice reason we have the hats for babies. Because this really bothers the parents. But when we tell them, it'll be gone in a couple days. And it does, it absorbs.
Is septal hematoma more blood and the caput is
More blood, and then again, well, it's often there's blood bruising kind of thing if they've had a trauma as well. And then, of course, they have to reabsorb that, which again is their increased risk for jaundice.
There's one that, which is actually the one on both sides, but it's actually got the blood swelling, not the caput. What?
Well, septal hematoma will be more on one side, whereas this crosses the suture line.
But then there's
It'll feel kind of mushy.
Yeah.
You're going to feel the fontanelle, you guys, right? Fontanelle, how should those feel? Soft, flat. Should they be distended? No. Should they be sunken? No. So flat. But if they have some trauma up here, it'll be kind of mushy and soft. Whereas the septal hematoma will be kind of on one side, the caput will be more soft.
and it would be harder.
Okay. Let's talk about infant reflexes. What are some normal infant reflexes? Moro, which is what? The startle. You're not babies. Yeah. Rooting, touching in the face. Babinski. The palmar reflex, yeah. Plantar grasp. How about the extrusive reflex? Extrusive. They stick their tongue out. People want to spoon feed their babies rice cereal when they're itty bitty tiny, and they stick their tongue out, they push against it. Extrusive. E-X-T-R-U-S-I-V-E. Extrusive reflex. What else? Stepping reflex. Yeah. Not so much, but just in touching and doing things, assessing them, you'll see that.
They go out.